The hour, a new killer is stalking the island of Haiti, cholera. The fast-moving disease has already killed more than 250 people and sickened thousands more. It's now in the crowded capital of Port-au-Prince, where officials fear the disease could strike thousands of earthquake survivors who are still living in crowded tent camps, and if it gets in there, it could spread like wildfire. Joining me on the phone now from St. Mark, Haiti, is Jason Erb. He's with the relief group International Medical Corps. So how troubling is it to you, Jason, that 5 cases of cholera have showed up in the capital city?
It's definitely very worrying. At this point, the cases have been of people who have traveled down from the Outbreak region. So it's a case of people carrying it with them, not of the disease spreading through a water source, and that's the big threat. The cholera won't spread generally from person to person. It's really when it gets into a large water source that it starts to infect a large number of people and becomes a major public health danger.
Right, but
it's definitely worrying. And sorry,
I was just going to say, but it gets into the water source through human feces, other contaminated matter. The people who have it in Port-au-Prince, have they been put in isolation to the best of your knowledge?
They're being treated, basically, and you have to have quite a large number of people contaminating a body of water. 1 or 2 people, defecating into a river isn't going to contaminate it. You need to have a whole village that does it as a habitual act over a period of years, for example, or months or something. So it's not just going to be 1 or 2 cases. That'll be something that's quite controllable. It's not good. It's a danger to the people around those individuals who carry the bacteria with them, but it's not going to lead to a massive outbreak.
All right, so the majority of cases so far has been contained to the area north and northwest of Port-au-Prince, and we've got a map to show some of the cities up there in the northern and northwestern part of the country. The government and doctors and relief organizations like yours are urgently trying to keep cholera out of the capital city. Do you think it's going to be possible?
It should be possible. Again, there's an awful lot of monitoring going on, what they call surveillance. And so when those cases do show up, and it becomes pretty clear, it's very severe and acute diarrhea. These cases generally don't go unnoticed, and so people are isolated and treated. And again, it's really about the water source. If the bacteria is able to seep into one of the major water sources for Port-au-Prince, that's when the danger is. But again, it's something we're all doing. All the agencies are doing a lot of training. We're in the camps. It is a danger because the camps are so crowded and the conditions are so unhygienic. So we're doing a lot of education for people to maintain good hygiene, good hand washing, clean water storage and treatment practices. We're doing a lot of education for recognizing the symptoms and what to do if somebody appears with the symptoms. Right. And so again, we'll be, I think, able to contain it fairly well. But it is a risk. It's a major risk. It's something that we're all very concerned about.
The number of deaths has gone past 250 now, and I think the number of infections is above 3,000, but the rate of infection, according to some reports, appears to be slowing. Could the tide potentially be turning here?
That's what we're hoping, and like you said, it's uncertain at this point. It does appear to be stabilizing so far. Hopefully, the work that the government and the United Nations and local and international agencies are doing up here in St. Mark and north of here is having an effect. But again, there's some of the more remote areas that are not so accessible, where we don't exactly know what's happening yet. We don't know the number of cases out there, and that's something that we're trying to get a better handle on at this point. And again, the government's even trying to do a sort of comprehensive needs assessment for the entire region. That hasn't been done yet. It's something that takes a bit of time to ramp up, and we've only been really aware of this for the past maybe 5 days or so, and so that's taking place right now. The hope is that the tide is turning, but again, it's sort of we're on the edge. It could either turn and stabilize, or it could become worse. Well, that's what we're all just sort of trying to make sure it doesn't happen.
Well, it's tremendous work that you and your colleagues in the International Medical Corps and the other relief organizations are doing to try to get a handle on this. Jason Erb, thanks so much for being with us, and good luck in the days and weeks ahead.
Sure, my pleasure. Thanks for calling.